and welcome to Dr. J Explains. Have you ever taken a sip of cold water, enjoyed an ice cream, or breathed in cold air and suddenly felt a sharp pain in your tooth? If so, you're not alone. Tooth sensitivity is one of the most common dental complaints, and today we're going to explore what causes it, what symptoms to watch for, and most importantly, how it can be treated. Let's get started. Tooth sensitivity, also known as dentin hypersensitivity, is a short, sharp pain that occurs when your teeth are exposed to certain triggers. Common triggers include cold foods and drinks, hot beverages, sweet foods, sour foods, and even cold air. The pain is usually sudden and brief, but can be quite uncomfortable. To understand why sensitivity happens, we first need to understand the structure of a tooth. The outer layer is called enamel, which is the hardest substance in the human body. Under the enamel is a layer called dentin. Dentin contains thousands of tiny microscopic channels called dentinal tubules. At the center of the tooth is the pulp, which contains nerves and blood vessels. When enamel wears away or the root surface becomes exposed, these tiny dentinal tubules are uncovered. Hot, cold, sweet, or acidic stimuli can travel through the tubules and reach the nerve inside the tooth, causing that sharp sensation we call sensitivity. There are several common causes of tooth sensitivity. One of the most frequent causes is gum recession. When gums pull away from the tooth, the root surface becomes exposed. Root surfaces are much softer than enamel and are more likely to become sensitive. Aggressive brushing is another common cause. Brushing too hard or using a hard bristled toothbrush can wear away enamel and contribute to gum recession. Worn enamel can also lead to sensitivity. Over time, enamel can become thinner from daily wear, acidic foods, and acidic beverages. Teeth grinding, also known as bruxism, is another important cause. Constant grinding and clenching can wear down enamel and expose the underlying dentin. Cavities can also cause sensitivity. When tooth decay reaches the dentin layer, it can allow external stimuli to reach the nerve more easily. Cracked teeth are another possibility. Small cracks can create pathways that allow cold, heat, and pressure to irritate the nerve. Some people may also experience temporary sensitivity after professional whitening treatments. Let's take a closer look at gum recession. When gum tissue recedes, part of the root surface becomes exposed. This can increase tooth sensitivity, increase the risk of root cavities, and create areas where food may become trapped. Since root surfaces are not protected by thick enamel, they are particularly vulnerable to discomfort. Another major cause is acid erosion. Acids gradually dissolve enamel over time. Common sources include soda, energy drinks, sports drinks, citrus fruits, and even acid reflux. As enamel becomes thinner, the dentin underneath becomes exposed, increasing sensitivity. Some patients experience sensitivity because of attrition. Attrition refers to tooth wear caused by tooth-to-tooth contact, often from grinding or clenching. As enamel wears away, dentin becomes exposed, and sensitivity can develop. Let's discuss treatment. The good news is that tooth sensitivity is often very treatable. At home, using a sensitivity toothpaste can help block the tiny dentinal tubules and reduce discomfort. Switching to a soft bristled toothbrush and using a gentle brushing technique can help prevent further damage. Reducing acidic drinks and foods can also protect enamel and reduce sensitivity. If home care isn't enough, your dentist may recommend professional treatments. Fluoride varnish can help strengthen enamel and reduce sensitivity by helping seal exposed areas. Desensitizing agents can be applied directly to sensitive areas to block dentinal tubules and decrease pain. If sensitivity is caused by cavities, worn areas, or exposed root surfaces, tooth-colored fillings may be recommended. For patients who grind their teeth, a custom night guard can help prevent further enamel wear and protect the teeth during sleep. In selected cases, where gum recession is severe, a gum graft procedure may be used to cover exposed roots and reduce sensitivity. Finally, it's important to know when to see a dentist. If your sensitivity is severe, getting worse, lasting a long time, occurring without a trigger, or associated with swelling or spontaneous pain, it may indicate a cavity, cracked tooth, infection, or another dental problem that requires professional evaluation. Thank you for watching Dr. J Explains. If you found this video helpful, please like, subscribe, and share it with someone who struggles with sensitive teeth. See you in the next video.